Children participation in youth sports is an excellent way for children to explore and develop lifelong skills. Youth sports not only play an important role in exercise but promotes mental and psychological advantages as well. It is well known that children who participate in sports are less likely to drop out of school and become involved in drugs and alcohol activities. Although sports participation provides numerous physical and social benefits, it also has a downside. The risk of sports-related injuries is estimated that 30 million children in the U.S. participated in organized sports programs. As more and more children participate in sports and recreational activities, there has been an increase in acute and overuse injuries. According to the Center of Disease Control and Prevention, more than 2.6 million children aged 7 to 19 years old are treated in the emergency room each year for sports and recreational related injuries. Emergency room department visits are highest among school age to young adult population. Over one-third of school-age children will sustain an injury severe enough to be treated by a doctor or nurse. Sports injuries can be classified in two categories: acute and chronic injuries. An acute injury is an injury which occurs suddenly and is severe enough in terms of pain and function impairment to prevent further participation. A contusion occurs when a hard impact causes local muscular damage and bleeding as the muscle is crushed against the bone. Contusions are most common in contact sports. Contusions can occur in any muscle, with the hamstring and the calf muscles being other common locations. A strain is an injury to a muscle in which the muscle fibers tear as a result of overstretching. Typically, symptoms of a strain include localized stiffness, discoloration, and bruising around the strained muscle. Severe strains sometimes require surgery to repair ligaments or muscles or tendons. A ACL tear is the tearing of the anterior cruciate ligament. Children are increasingly participating in sports where the mechanism of ACL injury is more common, especially girls who are more vulnerable to ACL injuries. These injuries are most often in non-contact circumstances, often during activities that involve deceleration or changes in directions of force. The child may experience a feeling of a pop at the time of injury. Swelling is common in the knee within 6 hours. A ACL injury can occur when the bones of the legs twist in opposite direction under full body weight. Little league elbow occurs during the overthrow. The inside elbow medially has traction placed on it, while the outside elbow laterally has compression placed on it. Little league elbow can become more severe, causing ligaments and tendons to tear. In addition, the tearing may cause tiny bone fragments to break off and travel to other areas of the elbow joint, distributing normal bone growth, resulting in deformity. This injury is typically seen in skeletal immature pitchers who throw over long periods of time. Patellofemoral pain syndrome, PFPS, is one of the most common complaints in youth athletics. When a child has a chronic dull aching knee of unknown etiology, typically the patient points to the patella as the source of pain, but the pain can seem to originate under or around the patella. The patient may state that his or her knee hurts when sitting for prolonged periods of time and when climbing stairs. The child may have tenderness to palpation on the medial facet, pain with or without patellar grinding, compression on the patella, and pain with isometric quadricep contractions with the knee in full extension. In children with Osgott's disease, there's a tenderness over the tibial tubercle. There can also be swelling and prominence of the tibial tubercle. Osgott's disease is most often occurs during growth spurts, when the bones and muscles and tendons and other structures are changing rapidly because of physical activity puts additional stress on bones and muscles. Children who participate in athletics, especially running and jumping sports, are at risk for this condition. Treatment for Osgott's disease includes rest, ice, anti-inflammatory medications, and quadricep stretching exercises. Knee straps are often helpful for some athletes because they decrease the traction forces on the tibial tubercles. In some sports accidents and injuries, the growth plate may be injured. The growth plate is an area of developing tissue at the end of long bones in growing children and adolescents. Most growth plate injuries, fractures, do not cause lasting problems. In some cases, however, the bone stops growing, causing it to become slightly shorter than other limbs, or it can grow slightly crooked when growth is complete. Sometime during adolescence, the growth plate is replaced by solid bone. The long bones in the body include long bones of the hands and fingers, metacarpals and phalanges, both bones of the forearm, the bone of the upper leg, the femur, the lower leg bones, the tibia and the fibula, and the foot bones, the metatarsals and the phalanges. Injuries are often considered a natural part of sports. However, like other injuries, sports injuries are potentially avoidable. For youth, this is especially important since the effect of childhood sports injuries can linger into adult years. Sports injuries requires advocacy to ensure proper equipment for sports participation. 16% of sports injuries, emergency department visits, and 20% of hospitalization were related to equipment, factors that may be amenable to prevention strategies. Preseason conditioning prepares children for strenuous activity they will have in front of them. Recommendations for leg strengthening under the guidance of an athletic trainer for girls who play soccer and basketball can prevent knee injuries. Reminders to throwing athletes of the number of pitches per week should be included in the pre-participation evaluation visit. Proper warm-up and stretching for all athletes should be emphasized. The office visit for a minor sports injuries provides opportunity for secondary prevention of further injury.